Welcome to Camp Constitution Radio with your host, Hal Shurtleff. This show is heard on WBCQ The Planet every Monday night at 7:30 Eastern Standard Time. And I'm very glad to be back on the show here. And just for your information, I'm going to be up in God's country. For those of you who happen to live near the Monticello area, I'll be heading up there Wednesday, August the 26th. I'll be speaking at Our Father's Place, which is a little restaurant, country store in St. Agathe on Main Street. At 6 o'clock, we'll be showing a documentary entitled Death by China. Thursday, the next day, I'll be a guest at the Rotary Club at Fort Kent. I think that's at 6:30 to 7 o'clock, so you'd have to call the Rotary Club to get an invitation. Then Friday, the 28th, I'll be at a McDonald's restaurant. We couldn't find any other venue in the town here in Holton, Maine. I think that's right on the main drag there on Route 1. That will be starting at 6 o'clock. We'll also be showing the documentary Death by China. And then Saturday morning at 9 o'clock in Presque Isle, Maine, at the Governor's Restaurant, I'll also be showing the documentary Death by China. I have a special guest with me, but before I introduce him, I want to talk a little bit about what's been in the headlines. The Planned Parenthood is an organization that, because of the release of some videos or some messages about the sale of body parts, it's nothing new, folks. Planned Parenthood has been doing this. In fact, they probably taught the Chinese communists how to do it since they set up shop, and that one child per family policy is something that International Planned Parenthood brought into communist China with our help, taxpayers' money. You see, this idea of a woman's right to choose has nothing to do with freedom and liberty. It has to do with population control. In a communist country where you have total government, they get away with it by just passing a law so you have one child. In a country that's supposed to be free, like our country, the United States, they say it's a woman's right, but it's really about population control, and don't let anybody fool you. And it dovetails nicely with Agenda 21, because one of the major goals of Agenda 21 is population stabilization. You see, there are too many people in the world, according to the Green activist. And in fact, Jacques Cousteau, the late beloved oceanographer, he said that we need to execute, I think he said 150,000 people per day. And he said this in an interview he did with UNESCO, the UNESCO Courier. It was a few months before the infamous Rio de Janeiro meeting where the Agenda 21 was introduced to the world. You can find that online, too, by the way. So this idea that Planned Parenthood has done something new we didn't know about. It was founded by a woman, Margaret Sanger, a wealthy woman, who was an anti-Christian bigot. She was a racist. She was an anti-Semite. She was a misanthrope, you can say at the very least. And she went to the wealthy, and there were a lot of wealthy people who thought there are just too many poor people, and we need to get rid of them. She had a Nazi doctor by the name of Ernst Rudin, R-U-D-I-N, write in her birth control review. And today you think these most of the people belong are those in the Democrat Party. In fact, abortion, homosexuality, and socialism are the three pillars. But you'll find Republicans supporting this too. I mean, I'm delighted to say that states have started to defund Planned Parenthood. Let's just hope they have the guts to keep doing that. Anyway, let's get to our guest. Our guest tonight is Dr. Edward Harshman. Dr. Harshman is a general practitioner. He's originally from New York City. He currently lives up in Maine, still a long way from where the studio is, by the way, in the Thomaston, Maine area. And I think he's got some plans to relocate to Greater Boston. Dr. Harshman, I've known Dr. Harshman for about 4 or 5 years. He is the camp doctor at Camp Constitution. He also is a member. He's taught a few classes as well, so he's an instructor and doctor. He's the author, I believe, of a novel and a few other books. You wrote a book, like a brain teaser book, haven't you?
Actually, 3 that were published by Sterling Publication, and then when they went out of print, I got the copyright reassigned and put them together into a brand new one.
Okay.
A brand new book of art.
And you could find those on Amazon, I think, and probably other venues. But that's not what we have you on, even though we do enjoy. I did enjoy looking at those, and was really challenged. I'm not your level Mensa. You're a Mensa member. I wouldn't even be an affiliate member, but I give it my best. But anyway, you are also a member of the American Association of Physicians and Surgeons.
That's right. Not to be confused with the American Medical Association, the AMA.
AMA. By the way, he has a knack for these. What's the right word? Changing the. Well, we'll get into that in a few minutes here. But you have been a long-time outspoken critic of socialized medicine in any sort, and especially Obamacare. And what do you call Obamacare?
I really can't express an opinion on that without using profanity.
Well, this is a family show here. Although being on shortwave, you do have a little more license, but we keep it clean since Camp Constitution stands for moral values and all. Obamacare is something that Congress passed, and we say Obamacare, that somehow Obama was the only one involved. This is a long time in the making, and you had this in Massachusetts, where I live. We had something called Romneycare, and Romneycare was really a precursor to Obamacare. In fact, there were some differences. I remember when I was doing my taxes when the first year of Romneycare, and for about 6 months, my family didn't have a health care plan because my wife was injured off the job, and we lost our insurance. She used to work for U.S. Airways, you see, and the union, they didn't care for any new employees after a certain date. They had absolutely no interest in them. So much for unions. So the union was absolutely no help. So all these people, the unions help the people, help the workers. Well, the union was affiliated with United, with U.S. Air, was absolutely useless to the working class, let me tell you. But anyway, because she got injured off the job, they canceled the insurance, and because my company, you can't get a policy unless you are either a new employee or start at the beginning of the year. So 6 months, we didn't have any so-called health care. Actually, I don't know why they call it health care. You only need it when you're sick. They should call it sick care or injured care. Not when you're healthy. You don't need. It's just maintenance, you know.
And insurance is supposed to be for an unpredictable expense, and people will say preventive checkups and other predictable expenses should be insured. So there's a great misunderstanding among many of the public.
Exactly. So anyway, when I did my taxes, it's according to the rules and laws of Massachusetts, there was a religious exemption, and I had some serious issues with the government policies of Massachusetts. So I happen to be a professing Christian, and they accepted it, and so I didn't have to pay a penalty. It was about $1,000. You see, these health care plans are supposed to help the working poor and the middle class, but they really work against them. But you brought an excellent point. If I insure my car, you insure your car, and if I get an oil change, I don't have to. My insurance company doesn't cover the oil change. It doesn't cover when the tires wear out.
It won't pay for the fuel you put in the tank. It
won't pay for the fuel. But if I have a health care plan and I go to the doctor for a routine checkup, routine maintenance, most Americans expect their policy to cover those kinds of things. Can you comment on that?
And I have, in fact, submitted claims for such things and been paid, and that is what people expect. And in fact, Medicaid in Maine and possibly in other states does encourage such preventive checkups to be covered by the government insurance. And there is a difference between saying, the patient has the responsibility, the insurance will help, and the insurance has the primary responsibility, and I get to repudiate all my personal responsibility. That's one thing about Obamacare, and I do remember it is also called the Patient Protection Affordable Care Act, PPACA, and with the same initials, I do call it the Powerful Politicians Achieving Catastrophe Act.
Well, you were just mentioning, I had asked you about these routine office visits and how people expect their health care plans to cover these routine office visits. Where, like I say, an automobile accident, yes, you expect your insurance to cover that. But when it comes to health care, when it comes to changing your oil, you don't expect your insurance company to cover that. In fact, they'd probably laugh you out of the building if you try to go there and claim on oil. Or even when it comes to this copay. Now, when I get under rare occasions, I need a medicament. Anyone in my family needs a prescription. In fact, you've actually helped us with some prescriptions about 4 or 5 when our children were sick, had the flu or something like that, and gave us prescriptions for some medications. That did a good job to antibiotics, I think. This idea of a copay, where you give them $1 for a prescription that was probably worth $15. I'm thinking, well, I know what they call these Cadillac plans, where you get everything. I mean, they roll up the red carpet when you come in. They give you a cafe latte when you sit down there and wait for your prescription. But I really don't know if that. To me, it just increases the number of the cost of insurance. Now, as a doctor, and you have an office in Thomaston, what about the defensive medicine? I mean, the millions of dollars that doctors, and even billions of dollars that doctors have to spend for insurance, for malpractice insurance.
Defensive medicine is intended to prevent malpractice insurance claims. That is one great increase in cost. And another, getting back to the prescriptions and coverage, many times patients who are more concerned with money than with their own health, apparently, will say, oh, a doctor, this non-prescription remedy, this nutritional supplement, which is safe and effective, is not covered by insurance. Can you write me a prescription that is? It'll save me $2 a month or something. And I find that is a very selfish and stupid attitude. And of course, it drives up the cost of insurance.
Now, with life insurance, if I was engaging in high-risk activity, if I was a heavy smoker or a drinker, or I was jumping out of airplanes without parachutes, or just jumping out of airplanes with parachutes on a regular basis, my rates would go up. That's understandable. Right? I know with some policies, if I'm a smoker, if I have some type of previous condition, if I had cancer, not too many insurance companies will cover me. But not everybody has the same lifestyle. The person who has a healthy lifestyle, that eats right, exercises, drinks, either doesn't drink or drinks in moderation, they're pretty much paying the same rate under this Obamacare, aren't they?
Yes, and that is a major deterrent to big USA business. Because if everyone pays the same rate within a community, then the people deciding where to put the factory will look at the community and they will say, oh, there are many people who have drug addiction or smokers or so on, because that's their lifestyle. And when I put my workers there, somebody is going to have to pay for their health insurance, and the rates are going to be higher because they're indexed to the average within the community.
It's interesting you brought that up, because this type of information is known to people in the business community.
They do the research much better than I can.
In fact, I remember I was mentioning a particular town in New Hampshire. I think it was Claremont. There's a manufacturing concern up there. I think can't remember the name of the company, whether they manufacture weapons or have you. And somebody said yes, there's a lot of drug addicts in Claremont. Now, you don't think of Claremont as being the inner city, but somebody knows that information, and when they know that information, the cost of doing business is much higher. I suppose if you're doing some kind of mundane job and you don't have much to look forward to in your life, maybe you'll be more inclined to drug addiction, especially as a nation, as a general. We're losing faith. So instead of putting our faith in God, we put our faith in men, and so we can understand why people want to get high and get drunk to escape these kinds of things. At least in their worldview. That's not my worldview. What types of intrusions in the average patient? When a patient will say, well, this is great because now I can afford to get that operation that I couldn't afford before, or but what are the many problems? And Obamacare, how many pages? Was like thousands of pages.
I think it was something like 4,000 pages of the law proper, and the regulations resulting from that, because this agency is authorized to regulate this, and that agency is authorized to regulate that, and the regulations themselves form a stack of paper 8 feet high if printed.
Now, I saw a flow chart, an Obamacare flow chart, and it was the most intricate thing. It had the patient was on the bottom, and the government was on the top, and there was just all these different. The patient was almost incidental to the whole Obamacare process.
Anyone who could understand that can probably sequence the human DNA more easily.
I would think so. It was incredible. You'd have to be a member of Mensa even to figure out how this thing goes. And now, my dad owned a drugstore back in the 60s and early 70s. I remember the days when you had general practitioners. They would make house calls. You've done that. And, yeah, I'm sure you probably would. You still do that. The price of a doctor's visit was very nominal, and we're talking about, in terms of the 1960 dollar that still had a little bit of silver behind it, right?
Right.
We're talking about $10 or $15.
I remember the $10 days.
And
I was very young.
But you weren't dying of starvation at charging $10. That was the going rate for a physician, at least in most areas. A prescription, it writes a prescription, he diagnoses the problem. A hospital visit was not that costly. But since Lyndon Johnson's Great Society and the welfare, I call it the welfare warfare state, but Medicaid and Medicare, so as federal government especially, and state governments got more involved, the prices skyrocketed. Just like education, the more federal government gets involved in the provider says, well, gee, the government's going to guarantee it. I can charge whatever I want to charge. And would you say that is the major reason why the cost of medicine, the cost of health care or sick care has gone up because of the government intrusion in the marketplace?
That was a problem from the start of Medicare until the 1980s and 1990s, at which time insurers started to say, no, this is all we are going to pay. And I was involved in the SEIU, Service Employees International Union, from 1989 to 1992, and there was the pre-estimate program, which was pioneered there by my boss and by the Deputy Research Director at the Local 32B32J in that SEIU, in which the insurance would either pay in full or somebody would call and say, you want $5,000 for that procedure? We have a board-certified surgeon who will do it for $3,000, which is what the insurance will pay. What do you want to do? Mm-hmm. And many doctors did not like that, but then again, the patients and the union finance people were very happy with it, and it paid for itself considerably, and then some, in terms of being a very good investment in the clerical staff. Get together, get a list of people who are good and who will accept the insurance as payment in full, and then haggle.
Now, there was, prior to Obamacare, of course, there was already a government intrusion to begin with. It wasn't something new. Obamacare wasn't the first to go back to the 60s. Prior to that, how do we get along? I should ask a question. When did the health insurance start coming into the scene? And was that a market innovation, or was it a sort of a government innovation?
That was the market. That was the Great Depression, and hospitals had some problems, and they started offering Blue Cross for hospital and only hospital insurance. And that was, I think, a coalition of hospitals or some other privately initiated process. I can't say I remember that in detail. And then there was insurance, including for old people, before Medicare came along, and President Johnson did coerce all insurance companies other than Medicare to stop insuring people eligible for Medicare, thereby forcing a monopoly and throwing people off of perfectly good policies that they really wanted to keep.
Just like what Obamacare did as well, right?
Similar.
Yeah, and it put a lot of people out. Or a lot of employers decided, well, I'm just going to lay people off or make them part-time, so I'm not obligated. Or if my company has less than 150 employees or whatever the figure is, I'm not obligated to give them health care. And a lot of, I mean, we live here in Boston. There's some places that I know that treat their employees very well, but they don't give them full time because if they did, they'd be out of business. So they'll have to. A lot of people don't know how the world. They don't know how the free market works. They think, oh, let the capitalists pay, let the big wealthy owners pay. Well, you buy your food in the supermarket. The markup is very small. They make money by selling lots of stuff at 2 or 3 or 4 or 5% markup. They have to employ people. They have overhead. So if the government says, okay, you have to do this for your employees, and the average, make them pay. Well, they're either going to raise their prices, they're going to lay people off, or they're going to go out of business. And then you're going to have fewer places to buy your food. And that's pretty much how it works. The people have no, or the government will say, yeah, we're going to pass these laws, and we're simply going to charge. We're going to raise the minimum wage too to $15 to $20 or whatever it is, and that will make them pay too. So that same thing happens. People get laid off, or the price of goods and services go up because it has nothing to do with the local grocer or the local convenience store or the local gas station. It has to do with the economic policies that the government's made. And they're not just looking at Obamacare, we're looking at all of the other OSHA and EPA and regulations just to get a loaf of bread to the marketplace. From the farmer, raising their grain to it being shipped and harvested. I mean, the taxes, the government regulation. It's amazing that you can still get stuff to the marketplace.
That's true. Healthcare does have its unique aspects in that there is obviously, the healthcare providers are rich. They can afford to take this pay cuts and blah, blah, blah. But the big money does not go to the doctors. It goes to the hospital administrators. It goes to the insurance companies that master the regulations and learn how to arrange matters for personal gain. Now, that's why the hospital administrators tend to be paid more than the surgeons who actually do the work. It's something that I consider very unfair. And when there is price control, then there is rationing. That happens directly or indirectly in pretty much all contexts. The gasoline rationing was threatened during the 1970s. Food rationing has occurred during Germany during World War II, Russia, and so on. When healthcare is rationed, Obamacare does include the Independent Payment Advisory Board. Unelected people, you might as well have chosen them from the likes of Idi Amin or
Pol Pot,
right, Pol Pot, or Ted Kaczynski, or what's his name, Tsarnaev, who will say, you're not worth keeping alive, so we're going to kill you.
So you're talking about the death panels. And I remember when Obamacare was being discussed, and there were the town hall meetings around the country. I went to a couple of them here in the Boston area. And they were poo-pooing the idea of death panels. And what it means is, okay, you're 75 years of age. The actuary table says that, well, you've got a certain ailment. The survival rate is 50 to 60%. The cost is going to be this much. You're just not worth saving. So you can go back to your home and die like a good American. Be a good patriot. And I know countries where they have this plan, people are raving about the Canadian medical plan, the English health care plan, and so forth. But this is what they did. So it sounded awfully nice until you actually got sick, and especially if you got past 60. I think there was a documentary that was done about Canadian health care. It was an answer to Michael Moore's. What was Michael Moore's documentary? Was it Sick and Sicker?
Something like that.
Yeah, and this was it was very tragic, and it showed lots of young people. We're not talking about, and again, a life is supposed to be precious from from conception to death, and anything the government gets involved in along the way is tyranny. Whether it be the poor lady that was living in Florida, and the Supreme Court said pull the plug, even when the family said we'll take care of her, it won't cost the taxpayer a penny, they still pulled the plug. The ex-husband, the husband wanted to get beyond things and what have you. So that's a tragedy right there. But so it showed people in their 20s, it showed young children, and by the time the documentary was done, half those people they interviewed had died, and they could not get the treatment. Simple like an MRI. And a lot of these people were coming to the United States under this horrible capitalistic conservative health care that they were paying, but they were getting the attention. In fact, I think it was a particular MRI device in a very populous part of Canada and Western Canada, and they said that after hours they let the animal doctors have access to the machines, and the dogs the owners of dogs got their dogs right in within a matter of days or hours, but you had a 6-month waiting period if you're a human being, Also, they have what they call medical tourism, where people will fly to Europe in certain places where they specialize in certain types of procedures and have a very good record.
Surgery Center of Oklahoma.
Now, you and I know doctor from New Jersey. She and her husband.
Eliana Heck.
Alita Eck, E-C-K, right?
That's right. She's in the American Association of Physicians and Surgeons, and I think she is or was the president of it.
She was at one point. Now, they've started a clinic. It's been there for a while, too.
Yes.
And it's a free clinic, but they just don't deal with the, okay, we'll take care of the operation, the procedure. If someone has an addiction problem, drug addiction problem, they deal with that they try to, because that person's going to be back there again in a couple of days or a couple of weeks, so they try to, I guess what they call holistic, deal with the whole person, not just the particular, sew the patient up and onto the next one. And you've actually toured the facility.
I did.
Yeah.
There was an AAPS meeting, and I and various other members had a tour.
You think that is one of the answers to Obamacare, if more doctors were able to do these types of things around the country?
I think that would certainly help. But Medicare does say if you charge anyone less than you charge Medicare, you are committing fraud when you send Medicare a bill. You have to charge Medicare the lowest rate. So as soon as someone says, I will give free care to these people at this clinic, then that person either cannot accept Medicare or risks going to jail.
So the government makes it very difficult for free people to give their services to the poor.
That's right.
You know, in a communist country, and it's interesting that in a communist country, they don't like to see the churches do any benevolent thing. The churches that still exist in these countries, because that's up to the state. That's the state's job to do that, right? And we see the same thing happening here. We see the same thing happening here to various extents. So now you mentioned in Oklahoma. What was the entity in Oklahoma?
The Surgery Center of Oklahoma, where no insurance is accepted, and surgery is done very inexpensively, sometimes for less than the copay that would be required through someone's insurance.
Now, what about nutrition? I know I've known doctors who have told me that they've learned very little about nutrition, preventive medicine, in medical school. In medical school, they deal with the symptoms and what chemicals they use, how they can cut things with surgery, or chemicals they can use to treat. You know, and I know there's a lot of people out there that everybody has their own. That take two of these and take some of these, but I have to say that nutrition and proper diet
that's important, and I think it's half a day per 4 years. There's all the nutrition instruction that one gets.
Half a day in the 4 years.
That's right. One lecture, or maybe 2 lectures in 4 years.
And you can go on YouTube and find more helpful things. I guess you don't know where to begin, from various treating cancer or how to treat certain ailments. It's funny, my wife, some years ago, I met a gentleman who was, I can't use the word disciple, but he studied under Dr. D'Adamo, who was from Connecticut, and I think he's still practicing, eating right for your blood type. And my wife got very into that, and she said certain types of blood, certain diets are better, certain types of food. And within a couple of weeks, a friend of hers came up to her, and she said, I've had this throat infection, and I'm taking all kinds of prescription medicine. Nothing's working. And she said, what's your blood type? Well, my blood type is whatever it was, A or O or negative. What are you eating? Well, I'm eating this and I'm eating that. Well, no wonder. It's your blood type. So she said, why don't you try this and try that? And within about a week, not only did the throat clear up, but she lost 10 pounds without having to cut her calories back.
No, nutrition is, as you say, very important. And I do remember at one point looking up something about mental health treatment and noticing that copper and zinc sometimes are important, and they could be out of balance. So I asked a few of my patients who had some psychiatric problems for 24-hour urine specimens, and about half of them turned out to be very short in copper. So after I remember one person said he couldn't afford the copper supplement, so I said, get a copper bracelet, you pay for it once. So he thanked me, and I don't know.
Really? The copper bracelet? And it just sort of the skin absorbs it?
That's right.
Really? So we're talking about a very small amount of copper.
Right, a small amount, but if that was all he could afford, then that was what he did. And at one point, the DHHS commissioner of Maine gave a speech about saving healthcare costs with various financial things in accounting and insurance, eligibility and such. And I raised my hand and I said, hey, wait, you forgot something. You can substitute copper for quetiapine, which is a very expensive psychiatric drug, And P.J. Syriacs, the British orthopedist, has some wonderful analyses of how to do a physical exam so you don't need x-rays and MRIs anywhere nearly as much. And there are lots of other detailed physical exam things, so you could say with proportion and diagnosis. Why? And never mind all of the therapeutic things with the copper and instead of the expenditures. Why are you not doing that? And then she went back into her speech about the finances, and I thought, good grief, did I make an idiot of myself or what? But at the end, I got some enthusiastic compliment from, of all people, the state treasurer of Maine.
Really?
He said, he thanked me for my comments, so I did a good job. So,
of course, if people started using nutrition and didn't need as much, it's almost as if the medical industry encourages bad diets and encourages using chemicals, because chemicals is always a counterbalance. So you take this pill, and in order to deal with the side effects, you got to take more, and it got you hooked. And it's a lifetime, and your life's going to be cut short most likely because you're not eating right. You get this poison in your system. It's not natural to the body. That's why you have side effects.
And the HMG-CoA reductase inhibitors, popularly known as statins, will reduce cholesterol synthesis, but cholesterol is important for brain function, so when people don't get it, then they start becoming less intellectually sharp. And if you look at the politicians we have, if they are taking statins, that may explain something.
That may explain it, yes. Maybe they're all on these things. By the way, you're listening to Camp Constitution Radio on WBCQ The Planet, which airs every Monday night at 7:30 p.m. Eastern Standard Time. It's broadcast out of beautiful Monticello, Maine, in Aroostook County. And then we're here with Dr. Harshman, Edward Harshman, who is a general practitioner. He's also the camp doctor at Camp Constitution. By the way, we had a wonderful camp just a few weeks ago, and our next camp will be July 10th to the 17th of 2016. Well, Doctor, we have about 5 minutes left, and I want to talk a little bit about the psychotropic drugs that are given to children all over the country, in mostly public schools, and the side effects, because it seems every time there's one of these shootings, we always, in schools or movie theaters or what have you, we always seem to find that the individuals involved are on these drugs. So can you comment on that?
I know it is a risk on the so-called SSRIs, the selective serotonin reuptake inhibitors, the fluoxetine, also known as Prozac, and the sertraline, also known as Zoloft, are two very popular examples. They are, in my experience and per theory, also can be replaced by increasing tryptophan in the diet, the turkey, eggs, milk products, and so on. And so I don't have a sign in my office that says, "Eat tryptophan, you turkeys," but it is tempting. So, and also in terms of attention deficit hyperactivity disorder, I do think that diagnosis is often a farce, because fish oil added to the diet will reduce its severity and incidence, and avoiding cognitive dissonance, which is a fairly sophisticated psychology concept. I don't think we have time for it now, will also reduce its severity and incidence, but those two tend not to be investigated. One, because fish oil is cheap, and the psychiatric drugs, which are Schedule II, which means lots and lots of doctor follow-up. You have to go back there for every prescription. You can't get a refill. The pharmacy can't do refills on Schedule II.
And it's big business, billions of dollars of these things.
And teachers know that the schools get paid more for a disabled student than for a normal student, so of course they're going to warp their diagnosis, and if there's any doubt, they're going to pronounce the child disabled.
So when you see a sign that says drug-free zone, like the school that's right next to your property there in Thomaston, they're not talking. This is where the drugs are actually being dispensed. That just means we don't want outside contractors known as drug dealers. We want to deal our own drugs with our own state-certified drug dealers called, doctors and psychiatrists, mainly psychiatrists. Our late friend Sam Blumenfeld did a lot of research on that subject, and he believed that it was a result, the ADD and ADHD and all these other alphabet soup diseases were as a result of the look-say method of reading. The children couldn't read properly, and they would they go in their classroom and their minds would wander, and especially the more intelligent ones. I mean, you're bored to tears, your mind would just wander, and because of that, you must have ADD. And instead of addressing the reading problem, they drug, as Sam would say, they drug the little so-and-sos, and now they're disabled, they're getting money from the state, from the federal government, and the drug companies are happy, the teachers are happy because the little docile kids there, but it has its, and most of these kids, thankfully, aren't going around shooting people up, but every so often they do. It's one of the side effects. So
I think it was Richard Bandler who suggested that if drugs are so important, why not drug the teachers and with something that would make them more energetic so they could keep up with the class?
Or just homeschool and get your children out of their clutches. So anyway, we're here with Dr. Edward Harshman, listening to Camp Constitution Radio on WBCQ The Planet. Doc, if the listeners would like to get more information about what you study, what books you recommend or websites you recommend to learn more about some of these nutrition concepts and what have you?
I have found there's some information actually quite good against soy from Mercola.com. He does believe in homeopathic medicine. I do not. There is that difference of opinion.
Mm-hmm.
And I'm trying to think of...
now, you have your own website, don't you?
It is probably going to be revised soon. It's a little bit out of date, HarshmanMD.com.
And you've actually produced some movies that are on YouTube. You have your own YouTube channel?
That's right, BrightWriter.com. Not all of those are medical, but that does have my Dr. Harshman's Medical Cost Control public access cable show from 1993. You can find it there.
Oh, great. And some of your movies are on Camp Constitution's YouTube channel as well. Well, Doc, thanks for being on the show. Thank you for listening. You're listening to Camp Constitution Radio, WBCQ The Planet, with your host, Hal Shurtleff. Until next week, God bless.